Jake was a healthy, happy little boy with dreams of becoming a comedian and a meteorologist. But in the 2nd grade, Jake and his family confronted a storm that no one could have predicted.
In 2nd grade, I noticed Jake was going to the bathroom a lot and just drinking all the time, to the point where I think he lost around 7 pounds because he wasn't eating. So we went to the doctor and found out that he had what's called diabetes insipidus, which is a problem with the body not making a certain hormone that allows your body to retain water. That in itself can be life-threatening. Takes medicine and he's fine. So, life went on. We thought everything was going to be okay. And then about a year later, he started school and he was having a hard time seeing the board at school and the teacher. So I took him to the eye doctor and found out that he couldn't see in his left eye. He was completely blind. The following, I think Monday
we got the results back for the MRI.
And there was a tumor.
I was hoping it wasn't very serious. I was starting to be kind of scared.
Originally, we saw the neurosurgeon first, and he's the one that said, this isn't really operable. If we do that, then your child has a chance of being completely blind. The tumor will keep growing to the point where he will be completely blind, and eventually he will die if we don't do something. And we were overwhelmed, and we knew it was a tumor, but nobody had said cancer yet.
I had a bad feeling in my stomach, just horrible. I was getting kind of scared. I was like, am I gonna die?
Jake is an excellent example of why multidisciplinary care is so important to providing the best care that we can for children with cancers, whether they be brain tumors or tumors in other sites of the body. We have been blessed by having the support of the Children's Miracle Network and their partnership with Children's Medical Research Institute that's enabled us to bring in excellent people from throughout the country to help with that multidisciplinary care. And we at our center are in a position to do that for the children of Oklahoma.
Jake participated in a clinical trial which was testing a combination of both chemotherapy and radiation therapy to try to cure more patients with this disease by bringing in new agents and trying to get all signs of tumor gone before he went to radiation therapy. And that's exactly what happened. Not only, hopefully, has this helped him, but the evidence, what we learned from this trial may help future patients have better outcomes.
First, it was denial that anything was wrong. When he was not drinking water, it wasn't because he was sick. He was just doing that to be a kid. And in retrospect, that's hard for me to live with, because that was a sign that I didn't pick up on. And the vision, he didn't say anything, so that's totally my wife's pick up on that she recognized he wasn't seeing, and she made the appointment and took him there. And I think that's probably what saved his life, is that she was able to pick up on that, because he got deathly ill in the PICU, and we had to do his chemo, all of his chemos in the pediatric ICU because of his diabetes insipidus. They had to monitor his salt levels in all of his vitals because of the nature of the chemo. And he had some pretty rough spots in there. When his salt levels got low, he'd get dehydrated, and it just made him ache and sore. And he hardly complained, because that's just the kind of boy he is.
And it just broke my heart to see how much he had deteriorated in that time, and how it could take him down so fast, and he lost one eye because of it, and that's what was so sad, him being so young.
He got 3 super whammies of chemo, and then after the 6 cycles, he also got radiation to his whole brain and spine, and focusing in on that pituitary gland. Jake will be on hormone replacement therapy for the rest of his life. He has needed a team of endocrinologists to help him with his growth, with his regulation of his fluids, with thyroid function, and responding to stress with cortisol. And so he remains on therapy for all of those for a lifetime.
My wish for Jake is that he absolutely remain cancer-free, and that he gets to do anything that he wants. He has just got such a great personality,
and a loving spirit. If I could send a message to anyone, it would be to donate to Children's Miracle Network so they can do research and find cures for these diseases that so many of our children have.
I think Jake is the pure example of attitude being 90% of the battle. There are kids who thrive through therapy because they have the attitude that they will get better. And Jake is the best example of that I've ever had. Jacob was a special kid from the moment I met him. It wasn't the cancer that made him special.
God's got plans for him. I know he's going places. And God's going to see to that.
Keep moving forward. Don't go to the past. Go to the future. Go to the future.